Hi everyone, I'm Dr. Lisa Erickson and welcome back to discuss climbing injuries of the finger and diagnostic ultrasound. Today I want to talk a little bit about the flexor tendons of the finger as compared with a pulley injury. Many patients come in and they say, my finger hurts right in the area of one of the pads of my finger, right in here, and I think I have a pulley injury. And the way that I diagnose that is with my diagnostic ultrasound. And what we look at is we compare the flexor tendons from the pulleys. And the two different views that we use is a view right down the top of the finger where we look at the bones and of the tissues themselves. So the view I have pulled up is of my finger. I have my hand immersed in a bucket of water and we're using a sonar type technique to look at the tissues, and the light or the sound waves reflect off of the bone and come back up to give us our image. So bone appears to be white, so all the structures on the base of the screen that you see are my bones. So here is a long bone, here is the head of that long bone, and here is a joint, and then another bone. So what we can see on this view is not only can we look at the bones to see if we have fractures there, some climbers will develop bone spurs in the middle where their tendons attach on the bone. I've seen a few of those even in young climbers. We can also see issues of the joint line itself if we have little floaters in there, or if we've damaged the joint, we will see a sign within the joint line itself showing that there has been trauma to the joint. And then I love this view for looking at the flexor tendons. And as we've discussed in previous views for anatomy, there are two tendons that run down your finger and are held to the bone with pulleys. So pulleys, if you're a trad climber, are just like cams or nuts in the wall to keep the rope from coming off the wall. Those are what those pulleys do, is they hold our flexor tendons along the bone so that they don't gap. That gives us the most amount of force. So zooming in on this photo, we can actually move the structures. We can actually do a motion-based view of that muscle gliding. I don't know if you can see it, but I'm wiggling my finger and the muscle is actually gliding back and forth on that tissue. And so I will zoom in so you can see that a little bit better. It's really kind of cool. So that is me moving my finger in a crimp position. So that is the flexor digitorum profundus gliding in there. And what we're looking at is we are looking at all the different bony structures and all the tissues and tendons to see, is the problem truly with the pulley itself, the A2 pulley or the A4 pulley or any of the cruciform pulleys, or does the problem come from the flexor tendons? So we look at the tendons and we evaluate how white those tendons are, and we evaluate how nicely the tissues glide. Is there scar tissue? Are they adhered? We can see tears. Sometimes tears occur from the tendon rubbing on the bone, and we get little tears that appear from below. Other times we get tears that occur from the top down or even mid-belly through the tendon. So we can see all of those with the ultrasound. So just to zoom in on that, I'm going to change the view a little bit. Get in here so you can see it a little bit better.